Alright, so the next disorder that we're going to be talking about is encephalitis. Encephalitis is very similar to meningitis, although it only affects the brain and the spinal cord, whereas meningitis affected the meninges, the covering of the central nervous system. So here is an image that is focusing on encephalitis, and it is actually being caused by the SARS-CoV-2 coronavirus. Okay? And so they do see encephalitis in some of the COVID-19 patients. So what is encephalitis? Encephalitis is inflammation of the central nervous system. So the central nervous system is comprised of the brain and the spinal cord. It is caused by infections very similar to meningitis, so both viral and bacterial, even though this encephalitis is more commonly caused by viral infections. Here we have a list that you can go over at your own speed. It is also caused by allergic reactions, including reactions to vaccines, and then autoimmune allergic reactions, so hypersensitivities to autoimmune functions. Now, when we get this inflammatory event, we have nervous tissue damage, and now specifically here we're going to be damaging neurons due to invasion, due to the increased inflammation event and the increased capillary permeability, meaning leukocytes are coming in, causing damage to cells. Okay. We can see this actually result from meningeal irritation, okay, and result and produce neurological damage because of really the inflammation and the damage events that are undergoing. So, we have different types of encephalitis. We have primary encephalitis and secondary encephalitis, and primary encephalitis is going to be just like any other primary condition that we've talked about this term. It is going to be a condition that is directly the result of an infection. Okay. Secondary encephalitis means that the infection started somewhere else in the body. Most cases of encephalitis go away on their own, but they can be life-threatening, right? So it's not usually you'll pick up on the manifestations, which we'll talk about in a second, and you'll go get treatment, and then everything will be taken care of, and most of the time it comes out okay. Now the difference between encephalitis and meningitis is that encephalitis develops gradually, where meningitis really develops a sudden onset, much quicker than encephalitis. So vulnerable groups to encephalitis include immunocompromised individuals, right? So individuals with autoimmune disorders, diabetes would be an immunocompromised person. Young children who haven't built up their immune system yet, and then elderly individuals also who start to see the decline of their immune system. Those are high incidence populations. The textbook also notes people who frequent the outdoors. My only idea about why that is that these individuals who spend more time outdoors are exposed to more pathogens, but that's a pretty weak connection. So we see several complications. Cerebral edema can worsen because of this encephalitis. Cerebral hemorrhage can progressively become worse because of the inflammatory event, increasing brain bleeding. And brain damage can result from the intracranial pressure from the swelling events that occur. So it's, like I said, it's very similar to meningitis. Okay. In most cases go undetected, right? So most fly under the radar, they clear themselves just fine. But for those that don't clear themselves without assistance, we might experience flu-like symptoms. Actually, this is probably going to be one of the big indicators. Flu-like symptoms, headache, and neck rigidity. Now at the same time, anytime you have nervous system disorders kicking in where you have swelling, oftentimes we get confusion resulting. So confusion and headache are going to be two really key hints that you have a swelling in the brain, right? So headache and confusion. Hallucinations, because now your neurons are having pressure applied to them. Now they are firing at will, and so you might get random areas of your brain firing, creating these hallucinations. Personality changes follows that same loop, same idea, and then diplopia. So the double vision or blurred vision results from increased pressure on cranial our nervous tissue in general. So much like the other neural conditions we've seen, we see seizures, right? So seizures can be a manifestation. Muscle weakness, paralysis would be kind of the same idea. Paresthesia is a different idea, and so paresthesia is numbness or tingling, and I don't really know why it's lumped in with paralysis, but it's not either or. The muscle weakness would be a more relevant term to kind of float with paralysis. Loss of consciousness, anytime we have disruption of nervous tissue, we suffer the consequence of loss of consciousness, or if blood flow is altered, meaning we're not providing enough oxygen to the brain, we're going to see tremors again, abnormal deep tendon reflexes, so we might see really accentuated reflexes like the patellar tendon reflex. Again, we might see a rash like we saw in meningitis, and then bulging fontanelles in infants and newborns that are born before their skull has had time to fuse. So the bulging fontanelle, again, is the fontanelle is on the first part of the front of their skull towards the anterior part, and it bulges up in response to increased fluid and increased intracranial pressure. How do we diagnose encephalitis? Do a patient history and physical examination, looking for any of the manifestations that we just identified, that we just talked about. Okay. We'll complete some imaging. We'll look at the head CT scan. We'll look at a head MRI scan to look at any kind of abnormal inflammation events or increased fluid buildup inside the head. Now, for clinical and lab measurements, we're going to do a lot of the same ones that we did in meningitis. We're going to conduct an electroencephalogram, EEG, to look at brainwave activity. And then we're likely going to sample the cerebral spinal fluid, looking for the presence of bacteria or viral infection or even some allergens or irritants. The polymerase chain reaction test is going to look for viral infections, and then another way that we could detect for these viruses is we could look for serum viral antibodies to look for presence of the virus has been in our body. How's it treated? Usually it's self-limiting, requiring no treatment at all, like I've said before. But if you do need some treatment, get some rest, adequate nutrition, and plenty of fluids, will likely do the trick. Respiratory support so if you develop some respiratory disorders, specifically pneumonia, because we could get in this pneumonia development, which is the main concern with the COVID-19 patients, is that you develop pneumonia in the process. All right, so for pharmacological support, you are going to use some pretty standard pharmacology now. So analgesics, antipyretics. So analgesics are going to take care of pain. Antipyretics are going to try to reduce the fever that you have in response to the infection. Antiviral or antibiotic agents are going to try to treat the causative factor. So antibiotic, bacteria, antiviral, viruses. Corticosteroids to reduce the inflammatory event. Anti-seizure agents to reduce the incidence of seizures, and sedatives to really take care of any personality changes that have occurred. All right, so we may try to provide some rehabilitation and supportive networks, specifically being reorientation support. Right, so the reorientation support is for a person who has suffered some fairly substantial neurological damage from this encephalitis, reorienting them back into normal life, right? And not just throwing them back into it and expecting them to adjust right away. Providing emotional support to the patient and their history and their family, and then also offering physical therapy, speech therapy, and occupational therapy to kind of mitigate any kind of consequences that they've suffered during this disorder. And so really the big thing is to prevent it from even occurring, right, by getting vaccinations, by wearing protective clothing, using PPE. So that's why it's so important that our healthcare professionals have adequate access to PPE. A lot of the infections come from insect infections. So insect infections can cause the infections themselves, so then transmit viruses, and then viruses get in your body and then infect you. So really reducing the effectiveness of you by wearing mosquito repellent, such as the 40% DEET, while it has negative consequences, really does a really good job of repelling mosquitoes, and then eliminating water sources where mosquitoes would grow and thrive. All right, so that is the end of the encephalitis lecture. Stay tuned for more audio lectures to come.